That's a difficult one to answer because it's very condition specific. But in general, whether you've had an injury and you need hand surgery for trauma, or you've got a condition that's not urgent, then in the majority of cases, an operation is not required. So most can be treated with splinting, therapy, activity modification. Now, when we split surgery into elective surgery, which is the non-urgent surgery, or trauma surgery, where you've had an injury, then there are certain sets of operations that are more common. Now, in the trauma side, it's very variable because you can have soft tissue injuries, crush injuries, cuts, broken bones that affect the wrist and the hand. So it depends on how significant the injury is, depending on whether you have the surgery and what type of surgery it is. On the elective side, the most common conditions that we operate on are the commonest conditions that we see. So for example, carpal tunnel syndrome, where you get a nerve squashed in the wrist, cubital tunnel syndrome, where you get a nerve squashed behind the elbow. You've also got trigger finger, where the finger gets stuck and you have an operation to open it out. And operations for arthritis, such as at the base of the thumb, which is a common place to get arthritis, or in the end joints of the fingers. And finally, I would say Dupuytren's disease, where you get a fibrous thickening in the palm and the finger starts to bend down and get stuck down. So they're probably the most common things that we operate on. Now, recovering from an operation is variable, but there's not a great variation in recovery. So for example, it depends on what your job is and what you need to do. So if you are in a more office-based job, then your time off work will be quicker. If you're in a manual job that especially needs bimanual handling tasks, because if you just have one hand operated on, then you can manage quite reasonably because you've got the other non-operated or non-injured hand. But if you're having to do jobs that involve bimanual tasks, then that is going to be more difficult. I would say for the more minor operations, you're looking at a minimum of 2 weeks off from most tasks, and with most operations, I would say you're probably looking at between 4 and 6 weeks. I think if you're looking at fracture surgery, where fractures take a little bit longer to heal, or tendon surgery for injured tendons, then that is usually between about 6 weeks and 3 months. Almost all hand surgical cases, both from trauma and elective cases, are day case procedures. So you will often come in the morning and go home at lunchtime, come in at lunchtime, go home late afternoon. And they're all done either under a general anaesthetic, a local anaesthetic, or a type of local anaesthetic where it puts the arm to sleep rather than just the individual part you're operating on. So I think in summary, with hand surgery in general, most don't need hand surgery for elective or trauma conditions. If you do need hand surgery, it is a day case procedure, and recovery time is usually between about 2 to 6 weeks in most cases, with driving being around about 1 to 2 weeks depending on the condition you've had operated on.